Good morning, students. We will continue competition number 3.1. Today's topic is glycemic index. The term glycemic index was given by David J. Jenskin and his co-workers. Glycemic index is the relative rise in blood glucose level in 2 hours after consuming a specific food, and it is different for different food items. Definition of glycemic index is it is the number from 0 to 100 given to a food and which represents relative rise in blood glucose level in 2 hours of consuming a particular food atom, and it is compared with glucose consumption. Therefore, the glycemic index of glucose is considered as reference and it is taken as 100. This is the graph to and the formula for calculating the glycemic index. The formula is rise in blood glucose level after giving a 50 gram of test meal divided by rise in blood glucose level after giving 50 gram of reference meal into 100. Now in this case, what we are doing is, first we are giving 50 gram of glucose to the patient, and every half hour we are taking the blood sample of that patient, and we will measure the blood glucose level in these samples. On the next day, we will give 50 gram of food atom which is called as test meal. The 50 gram of glucose which you have given previous day is called as reference meal, and the food atom which we want to test its glycemic index, that is given in the same amount, that is 50 gram, and again the same procedure is repeated. Every half hour we are taking the blood sample of that patient and we are measuring the blood glucose level in the patient. After measuring the blood glucose level in both cases, we will put the values of blood glucose level in this formula, or we can plot a graph which is shown below. The top graph which is shown in red line is the graph of reference meal, that is after giving a 50 gram of glucose, and the lower graph is called as test meal, which we have tested for a given food atom. So that lower graph is for test meal and upper graph is for reference meal. The graph of test meal is always lower than the graph of reference meal because, as usual, glucose has highest glycemic index, which is 100, because glucose is a monosaccharide, it is not digested and it is directly absorbed from the alimentary canal. If the lower graph is close to the reference graph, then the food atoms have considered to have high glycemic index. If the test meal graph or lower graph is away from the upper graph, then it is considered that the food atoms have low glycemic index. Again, I have told you glycemic index is directly proportional to insulin secretion and fat synthesis. Now this is about the glycemic index. We have divided into 3 types: the food with low glycemic index, mid-range glycemic index, and high glycemic index. If after calculating you will get a score 55 or below 55, then such food or such test meal is called as low glycemic index food. If the score is between 56 to 69 of our test meal or food atom which we have tested, it is called as mid-range glycemic index food. And if our score is above 70 for a test meal or food item, then that food item is called as food item with high glycemic index. Now the factors affecting glycemic index: quantity and type of carbohydrate. It is the most important factor. In the calculation of glycemic index, we have limited our quantity to 50 gram, but during our routine diet this quantity matters. If you take large quantity of carbohydrate in the diet, your glycemic index should be high. And again, the type of carbohydrate is also important. If you consume a carbohydrate in the form of monosaccharide, disaccharide or polysaccharide, that is important for glycemic index. Monosaccharide and disaccharide have high glycemic index because they are easily digested and absorbed, and suddenly blood glucose rises. But if you take complex starch or polysaccharides, they are slowly digested and the blood glucose level rises steadily. Second factor is presence of fats, proteins, organic acids and dietary fibers in the food. All these factors decreases the glycemic index simply by decreasing the digestion and absorption process. Cooked and uncooked food. As I have told you during the resistant starch, cooked food are easily digested as compared to uncooked food. Therefore, cooked food have high glycemic index as compared to uncooked or raw food. Next factor is presence of resistant starch in the diet. If resistant starch is present in the diet, it simply delays the process of digestion and absorption, thereby decreasing your glycemic index of the given food. Presence of dietary fibers also decreases the glycemic index. Again, the mechanism is same, by delaying the process of digestion and absorption. Also, presence of dietary fibers decreases the intake of carbohydrate. Means they form bulk of our diet, so we will consume less carbohydrate. Importance of glycemic index. As I have told you, actual insulin secretion depends on glycemic index. Food with high glycemic index stimulates more insulin secretion, and food with low glycemic index secretes less insulin. This insulin secretion is directly proportional to fat synthesis and diabetes mellitus. More the insulin secretion, more will be the chances of diabetes mellitus development in the future. High glycemic index food stimulate insulin level, have role in fatty acid synthesis, development of diabetes mellitus, and also in the obesity, because insulin is a anabolic hormone. Food with low glycemic index is advised for the patients of diabetes mellitus and obesity. Simply, again, due to the role of glycemic index on insulin secretion. So this is about glycemic index. Thank you very much.